Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine for our patients, our members, and the communities we serve. Thanks for tuning in.
All righty. So here we are. And I think probably the first thing we should maybe do is just go around and introduce ourselves to our audience. Turn it over to Dr. Swallow, our president-elect.
Thank you, Reagan. Hi, I'm Bill Swallow. I'm a PCOM graduate in 1979. I received a direct commission in 1985 as a lieutenant in the United States Naval Reserve, and I was recalled in December for Operation Desert Storm. We deployed to the Middle East in January of 1991, and were there for the duration of Operation Desert Storm. And most of us were attached to a fleet hospital, which, if you're unaware of that, is a 500-bed field hospital, and we supported 2nd Marine Division in our thrust south to north up into Kuwait and up into Iraq. I have 20 years in the United States Naval Reserve. I retired as a captain in the Medical Corps and enjoying a retirement from military, but still practicing. I boarded at family medicine and am intimately involved in POMA as a president-elect and also with the PCOM Alumni Association. So I'll turn it over to whoever's next.
Angela.
Hi, I'm Angie Jenny. I graduated from LECOM in 2005. I was a health profession scholarship program, scholarship person. And so that means that I was commissioned in my last year of college and then was in reserve status during medical school while I was going to LECOM. I was in the Air Force for 7 years, 3 years with my residency, which I'm boarded in family medicine, and I completed my residency at a combined program with St. Louis University and Scott Air Force Base. I then served at a remote location in Incirlik, Turkey for 2 years. And then my next assignment was at Kirtland Air Force Base. I practiced family medicine there as well. After then separating at that time, I did mostly urgent care medicine for about the next 7 years. And then I'm currently working for a Medicare contractor that does medical policy writing for durable medical equipment. So I'm a medical director with Neridian Healthcare Solutions.
Awesome. Thank you.
And I've been doing that for about 4 years now.
All righty. Our youngest member.
Yeah, my name is Daniel Rabe. I'm a third-year medical student at LECOM, class of 2025. I'm currently in my clinical rotations in the emergency room right now. I commissioned as a second lieutenant into the Air Force in 2021. So prior to my start of med school, and then following graduation, I'll continue on through there to the HB program and do residency, and then 4 years at least in the Air Force after that. But that's where I am at.
Thank you, Dan. I'm Reagan Shablowski. I'm a colonel currently serving with the Pennsylvania National Guard in the role of state surgeon. So I am the chief policy guy and advisor to the command staff for both division assets and state assets as far as the National Guard. Pennsylvania is kind of unique in the fact that we do have a division within the state, also a regular component of support for the state itself. The lucky part is that we actually have a division surgeon who does most of the work for the division. I spent a total of 2 combat deployments over in Iraq. I was also with the 2nd Marine Division, assigned as a medical officer in Ramadi, back when Ramadi was less than a nice place to be. And my most recent activation was for COVID. I spent about 18 plus months on active duty. We started out in Pennsylvania, worked the Eastern Conduit, then was assigned over to Eurocom and managed the COVID situation over there. Currently working in academia as a dean, assistant dean for plans, operations, training, and safety at Lake Erie College of Osteopathic Medicine up in Erie. I was a direct commission as well, and I've got about 27 years in, I think, so far, and still having fun as we move forward. So, I think it's great that we have 2 folks, one actively participating in the health profession scholarship program and one who has participated in. And just for our folks who may have family members or potential medical students or active medical students who are watching this, what did you think about the program as you're currently in it? And what did you think about it when you went through? Was it a good way to pay for medical school?
It was a perfect way to pay. For me, not having to have the loans, not having to have that debt when you are sort of done with your medical training was very beneficial, obviously. But even more than that, it was excellent training everywhere I went. You had the support for your family when you were active duty or even during residency. So that was also a huge benefit with that. And, it felt good to serve your country during those times as well. So I think there are a lot of benefits to it. I mean, it's not always really super easy to be away from, your family or things that you have to do as part of being in the armed forces, but it definitely was a great option for someone who was looking to get that assistance financially, but also looking to give something back. And like I said, really, I mean, people really sought me out for jobs because of my military background, because they know you have really good training, you're a hard worker, you're going to be on time. All of those things are great qualities. And so employers definitely look at that in the civilian world too. So I think it sets you up for success for many reasons. So I think it's a great option. I'll let Daniel go.
Yeah, I mean, I couldn't agree more. Obviously, I haven't gone through the extensive training and residency part of it, so I can't talk to that. But from a financial side, I think it gives you so much more confidence in your future, so much more peace of mind and everything like that. Obviously, medical school for a huge portion of the country is, signing up for a lot of debt and many years of paying that off and everything. And especially for someone like me, a non-traditional student, I have a family, that I'm at least partially supporting. To have that peace of mind, then, I mean, I wouldn't trade that for anything. And then as I go forward and everything that people I've talked to, I've met many military physicians and healthcare staff through my rotations, as well as a lot of people that have worked with military physicians, and everyone has had just the most glowing things to say about, not only their training, but as you were mentioning, the work ethic and the reliability that kind of gets brought out when you're in the military. So from my end, it has been a huge positive. And then, like you were saying as well, the opportunity to serve your country. I haven't done that part yet, but looking forward to it. And I think that offers a lot of benefits as well.
A question related for Angela and Dan, if that's okay. Guys, did either of you perhaps enroll in the ROTC program in your undergrad? If so, would you comment, especially related to the opportunity you now have in a scholarship program, or you're in the past, Angela? And if not, do you think it would be a perceived advantage to do so?
I was not involved in ROTC. That wasn't an option at my college, but I know others that did. And, you get similar benefits from doing that as far as the financial gains and some of the training that you get just as an undergrad with the military aspects and things like that. But I don't have experience. I'm not sure if you do, Dan.
No, I didn't do ROTC. So yeah, I can't really speak to that, unfortunately.
Do you think it would facilitate your entry into the scholarship program in medical school?
I don't want to speak for anyone. I've had a few colleagues that have done ROTC and one that did an academy and then HPSC. And I think that people just should be aware that, it's an extra step that it's not guaranteed. At that point, if you're in ROTC, I believe I'm saying this all right, but they've signed up for a commitment and everything post undergrad. So just being aware that you've signed up for that commitment and knowing that it's not a definite then to go to medical school right away. Yeah, I think that's just an important thing for people to be aware of.
So I'm going to put you both in the spot. You signed up, you went to basics probably between your first and second year?
You actually go right after you graduate from college. At least I did in the summer between graduating college and then your first, starting medical school. You do like what they call commissioned officer training, which is a basic training that's for physicians, dentists. I think nurses were in that program too. And it's a 4-week long program.
My question is, did your GPA increase after going through basics? Where they hardened your discipline?
It definitely did. Like I mentioned before, I was a non-traditional student, but I did go to training prior to med school. But, I guess I hadn't thought about it, but my GPA most definitely did increase. So it could be that.
Awesome. Angela, any comments?
I enjoyed my commissioned officer training. I thought it was sort of fun. And you learn sort of the basics of being an officer, how to salute and those things, which, again, the ROTC might help you in that case a little bit because you have some experience there, but you can learn it. You pick up what you need and things like that. And they take a little pity on you because they know that you're medical and you don't have that history and you come in already as a lieutenant. So people are saluting you, because people that are there for the traditional officer training, the basic officer training are there as well. And so sometimes they're saluting you from across the street and you don't know what's going on, but you learn it, it's part of the training. they have you ready to go by the time you're done.
Awesome. And I think that's an important point to bring out, right? The military will not put you in any place where you're going to fail. They're going to give you the skill set and the tools that you need to be successful. Because if you're successful, troop morale is good, patient care is good, and everybody comes home at the end of the day. Everyone's got that kind of apprehension. What if they put me somewhere I'm not, skilled enough to be? They're not going to do that. And, along that same lines, I think it's great that, our president, John Collada, has put together a task force to reach out from our state association to our members that are currently serving in the armed forces to help facilitate a transition from active duty practice into civilian practice, to help bring support to our veterans that may need that support. And I think also to provide support and into the service from medical school. Our task force has met a couple times. We've submitted one report to the board, and we're looking at ways to continue to evolve this process. And one of the key things is we just need to know who our members are that have been in the military or currently serving, just to reach out and let our main office know, whether it's a phone call or an email, or if you show up at one of our educationals, just to give us that data so we can help identify individuals to make sure that we get everything that we have to offer to them. What do you think, Bill? Your military training help you in your civilian career?
Oh, I think so very much. More so with working with corpsmen, especially. I know every clinic, every hospital, any naval hospital, any place you have a cadre of corpsmen who are more than willing to participate in any parts of military healthcare that you're involved in. And I know in particular, I've worked with corpsmen who've been suture better than we can. The only thing that they're not permitted to do is suture the face, but they are really whiz at that. And they also, if you like to teach the naval clinics, the naval hospitals, the staff just eat up whatever you have to offer. I know one 2-week active duty at Dahlgren in Virginia used to have a weekly x-ray review, and we put up films and go over them and teach them as far as interpretation, what to look for, what not to look for. And they just soak it up like a dry sponge. So yeah, my training was immensely helpful interacting with the naval side.
Awesome. So I guess this is kind of a pointed question that a lot of people know or want to ask, especially people looking at it, is like, we always talk about it being a bed of roses, right? We've got all these positive experiences going out and things like that. Is there a negative side that someone coming in should know about?
I don't know whether you look at it negative. You can look at it a couple different ways. But when you are recalled and deployed, especially to a theater of operation, it makes you feel a little bit uncertain of your future. I know when we deployed to Saudi Arabia, the reserve hospital, which I was attached to, was the only fleet hospital in the sand. There was a reserve hospital in Manama, Bahrain, and the active duty fleet hospital, which are all 500-bed field hospitals. The active duty one was in the port of Jubail. So we accounted for the care of 96% of the casualties in our theater of operation. And not knowing when the ground war was going to begin, not knowing how long it was going to take. And actually, our orders said he could be back in a year. It might be 2 years, or it might not be back. It all depended on what went on. And knowing that back end really didn't give you a warm, fuzzy feeling. But then at the end of the day, the experience was invaluable, absolutely invaluable. So there's good and bad, but the experience itself, if you look back, was immensely invaluable to your experience as a physician.
Yeah, I agree. I mean, there's definitely things that people should consider. Certainly, for me, my husband had to kind of accommodate the moves with his career. So, for example, when we moved to Turkey, he was leaving a teaching job. He was a elementary and middle school health and PE teacher. He was able to thankfully get a job on base as a DoD civilian doing the base exercise physiology job. So that was very lucky. But then he had to kind of put his career goals on hold while I was serving. And then thankfully, when we moved to New Mexico, he was able to finish his graduate PhD while we were there. So the families sometimes have to sort of sacrifice that time and putting themselves second as well. So we always have to remember the families when we're thinking of military service. Other things would be just, there is some certainly where your life is not your own, right? You're going to be told where to go. You're going to be told what to do. And so, those are challenging times. But just like Dr. Swallow said, for the most part, you sacrifice, but you also gain. You gain experience, you gain travel. Your spouses get to travel as well. And like I said, the military is super supportive for families as well. I had both my children when I was active duty Air Force. And so, there are challenges at the same time there are challenges in the civilian world too. So, you just have to kind of look at it big picture and see what works best for you and your family. But there are certainly things that should be taken into consideration when joining the military for anyone, but certainly for the medical side as well. So, but I will tell you that I had a lot of great experiences and great training, met a lot of great people. So certainly the benefits outweighed some of those negatives, but they are there. You just have to be aware of them. You don't want to go into it without talking to somebody. And certainly I'm always available for questions. I tell people how it is and different experiences. I think you shouldn't sugarcoat it totally, but there are a ton of benefits to being in that program. So,
Angela, that's a great comment. I agree with you completely. On the reserve side, when you're recalled and deployed, I left my wife and 3 kids. And at that time, in 91, our youngest was 5, our oldest was 14. And they were basically here in the States on their own, but they did have all the medical insurance covered by the DOD. They had access to the medical care and actually was the advocate for our reserve unit, which drilled in Williamsport. She was the advocate for our unit, which meant all the spouses of all that particular unit depended upon her for how to get around what to do, knowing the ins and outs here stateside. Well, we were all over in Saudi Arabia, and it was a tremendous experience for her. And she really had no regrets, especially since when I got home. But your point is very well made. And I think if we had to do it, we'd do it all over again.
Right. And you can't beat the free sub and car wash at Sheetz on Veterans Day. I mean, come on.
Man.
And I would completely agree with everything you just said. I mean, for me, probably the hardest part was just getting started with HVSP. It can be a little bit of a funky process, especially, for people that don't have a lot of experience with recruiters in the military environment, everything. You got to learn a lot and do a lot of things. That can be challenging, but I do think completely worthwhile. And then, like you were saying, that uncertainty, but then it begs the question, what med student really has any certainty in their life? When it comes to rotation, residency, we all go through the match. So I try to see it, whether it's civilian or military, there's a heck of a lot of uncertainty in our lives, in this field and everything. But that doesn't go away with the military at all. I got married 2 days before I went to see commissioned officer training, so they can throw you curveballs, but in big picture, I think it's worth it.
I always think of the old adage, right? Hurry up and wait, right? And I think it applies to the process of submitting an application to the military, whether it's for a direct commission or whether it's for a HP scholarship, right? Nowadays, it's electronic and on the computer, which makes things a little bit better. I remember typing mine. It came in a continuous form about yay thick. So it was about as thick as a Sears or Roebuck catalog, if anyone would remember what those were. And you stuck it in the end of your typewriter. It took me 2 weeks of typing because you'd go along and read the question. It's like, okay, who was my great-grandfather and where was he born? Thank God we had things like family Bibles and things like that to figure those things out, because a lot of times the people that knew were deceased because of the life cycle. And it's like, wow. One of the questions I think that oftentimes asked of people looking at it is, were you pulled out of class to go to drill? Did you have to go to training on a weekend that you had a test coming up on Monday? Things like that.
Yeah, I can take this one, I guess. No, I'm sure it's different for different branches and everything, but I've heard it's largely the same. You do maybe 4 to 6 weeks of training, generally the first summer before med school, sometimes that summer after the first year, and then possibly another set of training on a subsequent summer. And then in the 4th year, generally late 3rd year, early 4th year, people will do 2 months of audition type rotation as active duty at military installation. But other than that, there has been almost no contact even from the military. They've made it very clear that the first priority is become a doctor. Nothing can happen if that doesn't happen. So I think that's definitely been the case for me. I really had very little to do with that during the school year.
Angela, did you find the same, that they kind of left you alone and let you do your thing as a student?
Yes. Just like Daniel was saying, yeah, you pretty much did 1 month each year of med school, and that was it. You were active duty during that time, but other than that, they do support you during your medical school by buying your books and your supplies and giving you that stipend to pay for your housing and those sort of things. So even though they leave you alone, they are still supporting you while you're going to school. And then you do get the active duty pay during your active duty time. There are some nice parts of that as well. So it did help
I think also one of the things that we've kind of talked about, but is the military camaraderie, the friendships that you make being in the service. And it's kind of different than civilian where friends drift apart and then it's that kind of awkward reconnect at some time when you run into them. Whereas in the service, you may not see someone for 10 or 15 years. And within 5 minutes of seeing them again, it's like nothing ever happened. That time is gone. You're right back at that level of friendship that you had. Yeah, and, progressing forward with that development. They're the ones that have a flat tire somewhere and they're in the area and look them up. You call, not only do they show up with a jack, a 4-way wrench, box of donuts, and a couple cups of coffee to help you get your tire changed, right? Did you find that, Angela?
Definitely. I think some of that too, at least for us, was living on base, having a remote assignment. You lived next to the people that you worked with every day and you built those relationships. And like you said, I know if I was anywhere near them and I needed something, or they would definitely, like you're saying, bring food and to come help you. And there's a lot of, being outside of the U.S. together, you build that relationship because you're both out of your comfort zone. And I'm sure Dr. Swallow and you, Dr. Shablovsky, on, deployments and things like that, you build those relationships because you're kind of all in the same boat together, away from, reality, or away from your family, or away from the U.S. And it just is helpful in building that relationship. So definitely.
Each person in your respective unit, whether it's a clinic, whether it's a hospital, whether it's a department, each person in that is one of the cogs in the wheel. So it's a total team effort, regardless what the challenge is. And once that team is formed, you learn to depend on each other to do the teamwork. You rely upon each other, and it's a great relationship that oftentimes doesn't happen in civilian life.
That's so true. So again, I think the things that we want to point out is it's not a bad option to pay for medical school, right? The HPSP program. It's not a bad option for a practice environment if you are looking at getting into the service. And there's multiple different ways to serve, right? Active duty, guard, reserve are both very viable components to move forward. And each of those components has some sort of a student package for individuals in medical school to provide support. HPSP is pretty much straightforward active duty time, right? Once you've done a certain amount of it, you can kind of transfer over into a reserve status to pay off a portion of that component, but that extends your payback time, right? It's not going to be year for year, it's going to extend it out. The Guard does a little bit different method, the National Guard. And again, the National Guard is not just Army, right? There's the Air National Guard along with the Army National Guard as options. Again, it's a viable option for anybody who's watching this to see if it's something that's going to fit. I think also the fact that the military brings people together from so many different backgrounds, so many different cultures, so many different ethnicities. It is truly a big melting pot. And you soon realize that we're all in this together. We're all part of the system, right? Doing our component to it. And it really gives you, I think, some great people skills that you can always find that common ground to communicate on a patient coming in or an individual that you're meeting, to quickly enhance that communication channel and make sure that the relationship is going in a positive direction. And I think that's a skill set that is truly unique to military people. We've been talking for a period of time. I guess in the end, I think we'll just give each person a moment or two to talk about any unique stories or comments that they would like to give as a parting statement type of closing. And we'll start off with Captain Swallow.
Thanks, Reagan. I think one of the things I did not mention this evening, but I should, that occurs on the backside of one's career as a physician, and that's consideration to the Veterans Administration. For a few years, I worked in a community-based outpatient clinic in Pennsylvania, and the experience there, and it's a natural rollover from being an active duty or reserve and working with the VA, is the relationship you establish with your patients. I oftentimes said my finest patient panel was in the VA. They're more compliant. And again, if you want to teach them something about their medical problem, they will soak it up like a dry sponge, like I mentioned earlier with the others. And there are little perks if you are active or reserve, even retired, should you go on any sort of deployment or 2-week training. The VA is paid and it doesn't go against your vacation time or CME time. So there are little perks there. But you do cross paths with sometimes retired reservists, retired active duty, and it's just a natural rollover for those looking to maintain relationship with military personnel.
Very good point, sir. Very good point.
Yeah, the only other thing I might add is just to say, similar to what we've been talking about, is that there are a lot of options. So it doesn't have to be straight through active duty. I've had friends who have separated like I did when your time is paid back. I've had others that have, once they separated, gone back into the Air National Guard to continue serving. So there's a lot of options that people can consider within that. And the other thing I wanted to bring up too is just to make sure, again, as part of the task force, just reminding people, if you know a veteran physician, if you are a veteran physician, anything, please let us know your information, because we want to keep track of that for the database so that we can support you and we can help if there's a transition from military medicine to civilian medicine in Pennsylvania. And if there's any way we can assist, that's kind of what our purpose is. So I just wanted to throw that out there too. So we're looking for ways to help you or the people you know. So if you have any of that information, please get with us.
Excellent. Excellent.
Obviously, my experience is kind of limited at this point in my career, but trying to think of things that my experience so far in the military has shaped my kind of experience in med school. And I think the thing I think back to the most is just how much the military, and especially I think commissioned officer training, really prepares you for the unexpected. You know, I think that's a big point of training is adaptability and all that. But, you know, I remember the first day being told, okay, this is your squadron. And, you know, I was picked to be in charge, right? And I had absolutely no idea what I was doing. And now, you know, starting in the ED last week, still have no idea what I'm doing, but at least I've gone through, you know, an intense situation where, you know, I was helped when I needed help, but I was kind of allowed to, you know, make decisions on my own and try to kind of get my feet wet and everything. And I think the military is really good at that. And it's something that I think really benefits med students when they can become a little more comfortable, you know, in those unexpected situations.
Good point. Good point. I'm going to leave with a story about the camaraderie of serving. I was working in an ER on a holiday weekend, and it was pretty quiet. And we had a young couple come in and we're registering. And from the registration desk, it was an easy shot to look in at the nurse's station. And the male part of the couple kept looking down, and as I thought, eyeing me up as to like, you know, we have an alternative agenda for being here. And it's like, okay, this will be interesting, right? Got him back in the room. Nurse came out, I grabbed the chart and went in the room. Yeah, the female was the patient, but the male kind of, you know, interjected himself between me and the patient and started asking me all these great questions. And it's like, were you in the Army? Yeah. Were you deployed in the last 2 years? Yeah. Were you in Ramadi? Yeah. Were you? He was the truck driver for the supply chain that we had set up. And he would come in when they were able to get in, and I would go out and help unload the trucks because it was somebody new to talk to, right? And there's nothing else to do if you weren't actively engaged in your profession. And he was a truck driver. We had both been back about a year, and he had met a lady and was coming home to meet the family, that next big step in your relationship, right? They were both in college, and she was bringing him home to meet the family because it was getting pretty serious. And it was kind of like, wow. Once he spoke and got things going, I remembered who he was, but otherwise, you know, I'm thinking, who's this guy? But just again, shows you that relationship that you have. It's an ongoing, long-lasting thing. And if you wear a organizational patch or something on a jacket or on a hat, you know, people come up and say, when were you there? I was there at this time. And again, you know, we have our families, our nuclear families, we have our extended families, and we have our military families. And I think that is a very unique aspect of serving, in that fact that they're there for you. And just like POMA is there for us, right? Our military family is there for us. Our POMA family is there for us. And as Angela said, if you're watching this, you're a member of POMA or soon to be a member of POMA, you are a veteran or actively serving, please make contact so we know who you are, so we can get you the information and the support that we can offer, and to make your life a little bit better all the way around. Because, you know, DOs care, we care, POMA cares, our military family cares, in good times and bad. And there's nothing wrong with reaching out to anybody if you're in a situation where things aren't going so good, because we're here for you. And I think with that, thank you, everyone, for taking your time and being here with us tonight. I appreciate it.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts, and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube. Or email us at POMA@POMA.org. We'd love to hear from you. Join us next time for another edition of POMA Does.